Year-old man is evaluated in the ICU. He has end-stage pancreatic cancer. He has end-stage pancreatic cancer and was hospitalized 3 days ago for treatment of pneumonia. Respirations are 6 per minute. Pulse oximetry on 100% oxygen by face mask shows oxygen saturation 78%. Examination shows feeble respiratory effort. He is using accessory muscles of respiration. On mental status examination, the patient is oriented to person but not to the place or time. If the patient is able to the if the patient is not endotracheally intubated and mechanically ventilated, he will die within hours. His wife says that the patient recently told her that he would never want mechanical ventilation, but they never completed paperwork and regarding his wishes. His daughter insisted that he be mechanically ventilated. Which of the following is the most appropriate action for the physician to take?
Ready?
Yes.
Okay, so it is. Let's see. Nope. This one. Provide palliative only. Do we have wishes from the patient? Then look at the first line, spouse. Per, okay, I want to see the other answer. Why is it not in doctor care intubation only? Um, Provide palliative. Oh, is this one? Which one is it? No. Did you find that answer, that question somewhere?
No, still no.
Provide palliative therapy. Oh, is it? No, no,
Question
no.
4. Question 4.
Four. Okay, let me see. Yeah. The patient is at end stage of a terminal illness and presents with acute respiratory failure. He did not formalize his wishes in an advance directive, but verbally expressed his desire to avoid mechanical ventilation to his wife. The USMD emphasizes the importance of prioritizing the patient express wishes, even verbal, over other considerations when no legal document is present. Oh, okay. When presented with an ethical scenario on the USMD, always prioritize the patient non-wishes. Um, Remember that verbalizing wishes to a close family member often carries significant weight, especially without a formalized document. Got it. It's not C, perform endotracheal intubation. This goes against the patient wishes. Okay. So my question is, you see how so endotracheal intubation and mechanical ventilation is the same thing. Like it goes hand to hand, right? Or not?
Yes. Endotracheal intubation and mechanical ventilation. Yes, it goes side to side.
Because okay, because the daughter he says that the wife says that he will never want to be mechanically ventilated.
Yes.
But the daughter says that yes, do the mechanical ventilation. So none of them talked about the endotracheal intubation. They just say mechanical ventilation. So in their options, you say
Oh,
it says
without endotracheal intubation, how will you give
you
mechanical
cannot
ventilation?
do mechanic. Okay, that's what I want. Okay, got it, got it, got it. Okay, that's what I wanted to know. Because in the answer you see it says do endotracheal intubation only, but then I was like, okay, what's the point of that if you just do
Yes.
the intubation? Okay, got it, got it. Okay, next.
A 5-year-old boy is brought to the A 5-year-old boy is brought to the office for an initial well child examination. He was born at 40 weeks of gestation. and discharge at 60 hours of life. On newborn screening, electrophoresis showed FS pattern. He is at 50 percentile for length and weight. Temperature is 37. Pulse is 136 per minute. Respiration 34 per minute. He appears well. Examination shows no abnormality. Which of the following is the most appropriate next step? Ready?
Yeah, sure.
Up to 5 years, isn't it?
Penicillin until age 5, yes. Penicillin prophylaxis has sickle cell disease, electrophoresis, FS pattern, FES, little bit of A, little bit of S. Doesn't know. I don't understand what they're trying to say. Okay, management of sickle cell anemia,
This is,
vaccine,
I think,
maintenance.
that
To maintain.
sickle cell trait. If
What are they trying to say? That FS is straight? Is straight? Is it just a
probably,
straight? Okay.
or is it sickle cell anemia?
I don't understand what he's saying here. I don't
Little
understand
bit
that.
of A, little bit of S.
Yeah. Management of sickle cell anemia, maintenance, vaccination, penicillin until age 5, folic acid supplementation, hydroxyurea for patients with recurrent vaso-occlusive crisis, vaccination in pneumococcal vaccine, and penicillin is twice daily. For acute pain, hydration, analgesia, and transfusion. Let me see if they say something else. Oh, I have so many things open. This just doesn't even make sense. What is the other one? Okay, right here. Penicillin. Oh, yeah. Can you find that one?
Yes, yes. Question 16.
Six. 1 6.
Yes.
Oh, I'm too far.
Pro which one you need?
The all of them. No, not all of them. The penicillin one.
Prophylactic penicillin is initiated by age 2 months in infant with sickle cell disease to prevent. You found it? Okay, you read.
Okay. Prophylactic penicillin initiated at age 2 months. I thought the baby was 5 days.
Yes,
No.
5 days. It is written
Okay.
in the question.
But here it says you start at 2 months in infants with sickle cell disease to prevent life-threatening infections, particularly strep. For recently recognized that FS pattern on hemoglobin electrophoresis in a newborn typically indicates sickle cell disease. So it's the disease. When encountering a newborn with FS pattern electrophoresis, always think of sickle cell disease. The USMLE often test preventive strategies for sickle cell disease, with the early introduction of penicillin prophylaxis being a high yield point. Okay. Okay. I guess that's it. So it says 2 months over here is 5 days. So we start even if it's 5 days.
Like,
Okay.
just remember up to 5 years.
Up to 5 years. Okay.
That
Okay.
that is helpful because if you start looking at the timeline, so we should wait in this
Yeah,
case.
I guess everything else wouldn't, nothing else will make sense on this specific question. I guess. I mean, yeah. Okay.
Hello?
Yeah.
Okay. Can you hear me now?
Now I can hear you. Were you reading already?
No, no, no.
Okay. I couldn't hear you. It's okay.
A 1 week old female, a, a 1 week old female newborn is brought to the office for a follow-up examination after newborn screening showed a serum TSH concentration is 40 micro international millimole. Okay, leave it. 40. She has she has been breastfeeding well. She passes 5 to 6 stools and has multiple wet diapers daily. She has returned to her first birth weight. Vital signs are within normal limit. Examination discloses no abnormalities. Serum studies today show TSH concentration 14 and free thyroxine concentration zero point 0.4 nanogram per dl. Which of the following is the most appropriate next step in the management? Wait one second.
Mhm.
Yes, ready.
Okay. Is levothyroxine a child with high?
Very high probability of getting residency next year,
What do
inshallah.
you mean? Like if I apply this year, like
Yes,
if I.
yes. If you complete like
Mhm.
step 2 and apply this year, you have high probability.
You think so? Why
Yes.
did you
Why
say it
why
like?
why I am saying so?
Yeah.
Like there is like thinking this way.
Mhm.
Like in this year, if
Mhm.
you look at the whole world, like US is like dealing very rudely with all other countries. Even you are very astonished to know that US
Mhm.
actually planning to block the US actually planning to block to give new visas to the Indian people because he is very angry with the Indians. You got my
Mhm.
you
Mhm.
have seen already these
Mhm.
things.
Mhm. Mhm.
So lots of people will come in this time, isn't it? Like now they will apply and they are trying to come here and try to get residency if they want to. You got my
Okay.
point. So
Okay.
uh, as US is like very rude with other countries, so the program director and other people will think that if we take those people, then we have to fight with the government, and it is not possible. You got my point. Already,
Mhm.
Oxford and other like big Cambridge, they actually, sorry, the which university?
Like.
Columbia University and other
Uh-huh.
some of the university actually failed to do that. They are actually surrender with to the government because
Mhm.
US government
Mhm.
is actually planning to block
Yeah.
all the money for research.
That
So
that they give.
they will
Yeah.
they will not gonna like take the resident, and if they take the resident, that means they need the resident for a year, isn't it? If they will take somebody that they are not getting
Mhm.
for the whole year, that would be a
Mhm.
great loss for the hospital, isn't it?
Yes.
So they this year they will plan to take more and more US citizens. Mark my word, you will see.
No,
So
it makes sense. I mean, yeah,
it actually makes sense. Like
it makes sense. Okay,
they
what you
are
said.
very rude with the China. They are very rude with the people who are applying for the residency. Mostly Chinese, mostly
Yeah,
Indian,
Indians. Yeah, yeah,
some of the Pakistanis.
yes.
So if you look in the whole scenario, all like most of the country is blocked. Like Iran,
Yeah.
these
Yeah.
people are also working in the US. They are
Yeah.
not able to apply also. They are
Yeah.
planning in such a way. And in the Israel, the situation is not good. And I don't think that the people are people are able to concentrate. If your country is war driven, it is not possible to
Yeah.
study, isn't it?
That's why I was so surprised when my tutor told me, like, I was like, how are you getting bombarded with bombs and you have time to like, do your visa and all these things and planning. I was like, wow, that's you have to be mentally really strong.
No, the Pakistan is a different country. If you look at the Pakistan, is a different country. There are
Yeah.
two kinds of people living in the Pakistan. One, from the birth, they actually plan to go outside and settle there. Truly,
Oh no, seriously,
and
it's
they are
like,
and some of the Pakistani people are so rich, they
mhm.
they can afford any country.
Oh,
And the some of the people who are not able to come out from this country, they are actually with the government, because what is the problem in the Pakistan, that the people who are close to government, they are getting jobs and they are getting everything, and the rest of the people is suppressed. So 50% people is very uh, is not satisfied with the government, so they are planning to leave the country as soon as possible, and 50% people are
mhm,
very good with the government, so they are
mhm.
staying there. So they are divided, and they are studying
Yeah.
in that way for very very long time.
For a
And
very long time.
yes,
Yeah.
and their situation will not gonna change anywhere.
Anytime soon. Yeah.
Mm,
Yeah.
because like it is very surprising, US government is actually behind the Pakistani situation. Truly, they are
Mm-hmm.
actually giving money to, actually sometimes they are giving money to sort out against the crime, and they are giving money to do the crime, and they are actually doing everything.
Yeah. No,
Because
I understand what you're saying because even on the Reddit, a lot of people like international students, they're like, everything is opening late this time. Can the residency programs just change the deadlines? Because it's not a lot of people are behind for the visa. A lot of people got the visa denied.
they US
You
actually
know,
block all the visas.
yeah. So the people are like, the residency program should try to push the deadlines.
Do
So we
you
have.
think that it is possible? Residency
I don't
program
know.
will
I don't know. I don't know.
it will never gonna happen, because every circle you need doctors, you need hospital
Yeah.
to run. It is not like that. It is not a job.
Yeah. Yeah. Yeah.
You need the doctors to run your hospital. So
Yeah,
you can't do. You need doctors. So the program director or everyone will think in that way. So
yeah, that's true.
your chance of getting residency this year in a good school is high. If you just
Just have
complete
to
your,
pass my
yes,
step.
yes, true,
That's the
truly.
key.
No, it's a push. It's not
Yeah.
a. I am saying this for,
Thank you, Omar, for making me more nervous. Now my anxiety is going to go up now ten
no.
times more.
If your anxiety is up and this anxiety is dragging you to get a good score and getting into the residence, that is a good anxiety.
That's a good.
Because if you just wait for the good time to come, there is nothing called a good
Never
time,
gonna be. Yeah, yeah,
because
yeah,
it will be day by day the exam is getting complex, so you need
yeah.
to,
You,
either you need to go in or you need to get out.
yeah, I get it. That's true. That's true. Yeah, every day is that's true. Because
because
every
because
now,
because the as the day passes, you will be so nervous and frustrated,
yeah,
your
yeah,
brain will not gonna work.
yeah,
We have to work so hard to come this far.
Yeah, I'll be. I've cried enough. I need to pass this exam at this point.
No, no,
I need,
you are in a good shape. Just feel that you are in the residency. Then,
I'm still
then you will get a boost, and it will help in your studies.
at this point. I just want to pass this thing. I don't even thinking about residence. I just need to pass this exam and just breathe. I feel like I'm not breathing. Like even when I sleep, I
Don't
feel like
breathe. Don't breathe.
I'm dreaming about.
You will breathe at, at your match.
Yeah, I feel
You
like
will
I dream
breathe at
about.
your match because after that you have a lots of things to do. So keep
Yeah,
your patience.
yeah,
If you just finish the exam and just think that I have got everything now, it's time to take rest, it would be a great loss. The next
okay,
year it will not be the same.
yeah,
This
okay.
this year is a very unstable year.
It's so
So
unstable.
so
It's
give your
so.
best because you can see that Apple company is forced to build his new office, to build his new what can I say factories in the US.
Mhm.
They are actually
Mhm.
forced.
I saw that. Yeah.
So don't you think that Trump will force the medical sector to
Oh yeah.
do it?
Oh yeah.
Obviously, he will do it.
Yeah.
Mark my word, he will do it
Yeah.
because he need to cut the cost. Why he will give the money others apart from the US citizen? Isn't it because
Yeah.
he is trying to make the MAGA?
The man.
I
the
know
way you,
everything, so
the
don't.
way you said it is like the MAGA. It's the
I try to talk it like Trump.
like, oh my god. But yeah, the things are changing too fast. You saw this whole my in health thingy. They try to the new thing
No,
that they're
no,
trying to.
no. They are actually. You should be thankful to Trump because he is actually trying to give something to the US people, not to the others. Because
Mm-hmm.
the you will see that if he stays, he will try to give something to the US people.
No, but I understand. I like this idea that he wants everything to be with the for the US people. Okay, fine. But that doesn't mean
Yes.
that you need to push everybody else. At the end of the day, I'm
If
not
you
gonna lie.
if you so remember in that way, if you don't push, he will not gonna do. Everybody is a money lover.
Yeah.
Just think in that way. In China, you are in forced to bound work in there. And do you remember the Jack Ma, the
Mm-mm.
greatest person like mm, what can I say? He has a big company like Alibaba. The
Oh yeah, Alibaba. Yeah, I know.
he's the founder of the Alibaba.
Oh, I didn't know.
Jack Ma. He one day he told something. He told against the Chinese government, and the Chinese government just called him and make him underground for 2 years. Now he is with the Chinese government. So you
Oh.
need to force people because if you talk against a country, like other people will get something from that and try to destroy your country. Chinese government has everything. They can make everything. You got my point. They built in such a way they don't need anybody to stay in the world.
Mhm.
So so Trump actually knows everything. So so he's actually forcing that not to depend on the China, not to
From
depend on the
China,
other
yeah.
countries. Because if you give all the parts in the China, if you made all the parts, Apple company is a very versatile company. Uh, if you take help from them, then what? we will do. The next day, the China can make the apple.
Mm-hmm. That's true.
Okay, lots of talk. Okay, let's
No,
study.
I'm not. No, I.
No, no, I try. I have said so to boost you up because you are you are planning to just finishing the exam and take it in a easy manner. Don't do it. Give a paddle in your, what can I say, in
Yeah.
your car, and just move forward and give your best up to March.
I think I was just trying to. I was like, I'm not gonna rush myself. If
No,
if
no.
I don't
uh,
if I don't take the exam this year, it's fine. I'm not gonna rush like last year. I'm not. Listen, I'm not. Even
y-
if I don't have to apply this much, it's fine. I just need to make sure I'm ready to pass the exam. Because
yes.
my tutor told me yesterday. I think it was 2 days ago. He was like, "You are ready to take your exam. Like, just
So
go."
he's he already told you because he
Yeah.
has found that you are prepared for the exam.
Yeah.
So
Yeah.
what
So, but I
you
don't want to rush. I don't.
sorry,
What if? But I don't want to rush. What if
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 you if you don't if you if we study, we can study for this year, for next year, we can study for prolonged period. This study will not never gonna end.
Okay.
You got my point?
Yeah.
Like suppose we have finished doing eWorld. If we start doing Amboss, we can do it for the next 6 months,
Mm-hmm.
isn't it?
Mm-hmm.
Do you think that we will get all the questions right if we start from today? It is not possible. It doesn't work like that
Yeah.
because uh, this syllabus is actually the whole curriculum of MBBS and the starting of your MD journey, and it will cover your half of the MD journey, like us, like your residency journey. If you are in the like internal medicine, it will cover everything. You don't
Mm-hmm.
need to do extra.
Mm-hmm.
All you need to do is to work and learn the technique of something.
Okay.
You got my point? Okay,
Yeah.
leave
Oh,
it.
okay. No, I'm glad you said that because like I said, my tutor said it, but I was like, I don't feel like I'm ready yet. Now that you say, you're like, okay, I'm like, okay, maybe your Mark sees something. Maybe he's seeing that, okay, you're
I
doing
am
this.
seeing the greatest opportunity as well as your greatest dedication. You have worked so hard to come this far. Now, if you delay, you will forget.
Oh,
It
okay,
is
yeah, that's what he said too.
it
Yeah.
it is true. If you delay so much, you will forget because we are forgetting each and everything. The thing we
Yeah.
have learned first. They Do you remember? I don't think so.
No, you did. You saw the Ottawa thingies. We remember we did it so much at the beginning, and
Yes,
still now I forgot it. I can completely forget.
but the thing that is, that we have to go through the Ottawa rule. That is the thing
Yes,
we left.
yes, yes.
Okay,
Okay. Thank you for the pep talk. I needed it because I was really like, I don't trust my tutor. Maybe I'm not. I don't think I'm ready. So now that you said, it, I'm like, okay, okay, maybe I need to start thinking about, taking the exam now. Okay. Okay, levothyroxine therapy. The neonate has elevated TSH low free thyroxine concentration indicating primary hypothyroidism. For USMLE, it's crucial to note that congenital hypothyroidism is commonly caused by thyroidigenesis and warrants early initiation of levothyroxine therapy to prevent intellectual disability. They recognize the key findings of elevated TSH and low FT, I don't know, in neonates to indicate primary hypothyroidism. Early identification and treatment are vital to preventing irreversible developmental and intellectual delays. It's not monthly TSH and FT measurements. Monitoring is essential, but immediate treatment is crucial. And it's not ultrasound of the thyroid can reveal structural abnormalities, but no role in the treatment. Okay, next.
An 18-year-old patient comes to the emergency department because of 2-day history of severe abdominal pain. This pain began in the middle of the abdomen after a large meal but now is localized to the right lower quadrant. The patient has 2 month history of intermittent diarrhea, 2 month history of intermittent diarrhea. 3 weeks ago, the patient has upper respiratory tract infection that resolved spontaneously. The patient is currently taking no medication. The patient identifies a non-binary and uses they or they pronouns. They are assigned sex at birth was male. They do not smoke cigarette, use other substance. Temperature 37 pulse 80 per minute. Respiration 20 per minute. Blood pressure 110 by 70 millimeter of mercury. Abdominal examination show fullness and tenderness to the palpation to the right lower quadrant. Leukocyte count is 11,000. Which of the following is the most appropriate next step in the match?
He's 18.
Is it IBD?
Oh, you think it's IBD? I thought it was appendicitis.
2 month history, 2 days.
Okay.
No, no, no. You may be right, but look at here.
Mm-hmm.
The patient has 2 month history of intermittent diarrhea.
Diarrhea. Okay, okay,
Is
okay,
it
okay, okay.
here?
So,
You are see the pain begin in the middle of the abdomen after large
yes,
meal, but is localized to the right lower quadrant. That's why you said.
yeah. For you right with the diarrhea, it does make it. It does make it. He doesn't smoke. At least it's. We know it's between those two. But shouldn't it be the same thing for? I mean,
But
it would.
leukocyte count is slightly high now. It is high. Maybe it is appendicitis.
No, the cycle is not. Is normal. I think
Is
the high
there
is.
is fever. There
Oh
is
wait,
fever.
fever. Yeah.
There is
Okay.
fever and leukocyte count is slightly elevated. So maybe appendicitis.
Okay. So in IBD there is no fever, and the leukocyte count is normal. Okay. Let's check.
Should we go for CT or abdominal ultrasound is
That's what I was between the two. That's what because he's 18, so he's not a baby, and he's a boy. He's not a girl. So city I wouldn't mind city, but not babies and pregnant women or whatever is abdominal. It's ultrasound. So do we do city? Okay, let's check.
fine. Okay.
Pick one.
Okay.
Okay. It is city. Weird, non-descriptive questions. Severe abdominal pain now localized in the right lower quadrant. No fever. Uh, oh, she has fever. Decent normal white count. Yeah, the white count was not elevated. It was is 1100 and 500. 11,500. That's elevated. But could possibly be appendicitis. So he doesn't even know what it is. Anyway, let me check, let me check the other answer. Oh, it's the thing. CT scan of abdomen. Abdomen. Is it this one? No, it's not this one. No, it's not this one. No, not this one. Nope. 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 Maybe this one. Yeah. The patient's symptoms of abdominal pain localized to the right lower quadrant of after an upper respiratory infection, along with history of intermittent diarrhea, suggest. Okay, this one says Crohn's disease. Divine say it was appendicitis. This one says Crohn's disease. A CT scan of the abdomen is appropriate diagnostic step for evaluation of complication of Crohn's, such as abscess, fistula, bowel obstruction. For US simile, When suspecting inflammatory bowel disease with potential complications, CT scan provides detailed imaging of the to evaluate for full extent of the disease. Crohn's can affect any part of the GI from mouth to anus
So it is Crohn's,
and often
and it is a
presents with,
complication of the Crohn's. That's why it is CT scan. It
yeah.
is not appendicitis.
Even if it was appendicitis, it would still be CT scan. That's I think that's what Divine was trying to say. It doesn't matter here if it's Crohn or appendicitis, you will still do the CT scan. That's what he was saying. The question is vague, but it doesn't really matter. Crohn disease affects any part of the GI from mouth to anus and often presents with rather quadrant pain, mimicking appendicitis. I was always consider underlying chronic conditions when presented with an acute symptom picture. I don't know what that means. Abdominal ultrasound CT offers more detailed imaging of all potential complications. Okay, yeah, I think that was the key here. You didn't really need to know if it was appendicitis or CT or Crohn. Either way, you will need a CT.
Okay. A 25-year-old, a 25-year-old, okay,
It's
let's
okay.
start it.
Mhm.
A 25-year-old woman, gravida 3 para to 36 weeks of gestation, comes to the emergency department because of heavy vaginal bleeding following sexual intercourse 3 hours ago. She has received prenatal care. She has history of serious illness, operated procedure. Vital signs are normal. Continuous external fetal heart monitoring shows baseline 155 per minute. No acceleration or deceleration. No acceleration or deceleration. The uterus is consistent with size. Uterus is consistent in size. A 36 weeks of gestation tocodynamometer monitoring shows tocodynamometer monitoring shows contraction every 8 minutes. Which of the following is the most appropriate next step in the management?
Ready?
1 minute, please. Ready.
Okay, it is transabdominal ultrasound. Patient who's 36 weeks pregnant, multiparity, bleeding after sex. Do we know exactly what's going on? Whether is it placenta or vasa previa? Pick a diagnostic test first. Never be. Okay, so never do digital exam. Let me see if I transabdominal. In the patient with late pregnancy, vaginal bleeding, placenta previa is a key differential. It is essential to determine the location of the placenta before considering any digital exam or manipulation. For USA media, understand that transabdominal ultrasound is the first step to diagnose or rule out placenta previa when there is unexplained trimester bleeding. Pregnant patient with painless bright red vaginal bleeding, especially after intercourse in the third trimester, should raise suspicion of placenta previa. For USA media scenarios, the absence of pain
Your
differentiates
screen is
placenta.
stuck.
Okay, let me stop it and let me restart it. Okay, I restarted it.
It didn't come yet. Okay. Keep studying. Keep reading.
Did they come yet?
No.
Oh, hmm. Okay, let me stop it again and then start it. Okay, let's see. A pregnant patient with painless, oh, yeah. For USMLE scenario, the absence of pain differentiate placenta
Okay, I can
previa.
see it now. Okay.
Yeah, perfect. Absence of pain differentiates placenta previa from other conditions like placental abruption. It's not C-section. Diagnosis should be made first. First, premature C-section might not be necessary. Digital exam, digital exam of the cervix contraindicated in unexplained third trimester pregnancy, bleeding because of the risk of provoking massive hemorrhage of the placenta previa. And oxytocin used to induce labor not indicated without a diagnosis. Okay.
Next,
So oxytocin, I have a question. Oxytocin, is it given when, okay,
oxytocin is given after the
is it,
delivery for oxytocin is given just after delivery to prevent PPH, for uterus to get back its original size. Like there is a uterine contraction, isn't it? Ox,
no, I
ox,
wasn't talking about that part. That part, yeah, to stop the postpartum bleeding. No, not, I wasn't talking about that part. I'm
yes.
talking when it's given to induce the contraction and for the baby to
It,
come down. So,
it can give it can you can give oxytocin for
but
uterine contraction. Yes.
is it after the cervix is like once the cervix gets to 10 centimeters dilation, or is it when the baby is already coming down? You get what I'm saying?
Oh
So the
yeah.
first stage,
If
first,
like it is usually normal contraction cause the baby to come out. If the contraction is normal, you don't need to give anything. But if the contraction is not adequate, like you are seeing that contraction is not adequate and baby is not pushing down and the mom is fatigued, now you should give oxytocin.
so it doesn't depend in the if the
The
cervix is already dilated or whatever, or how much the cervix is
yes,
dilated and
I don't think that it does not go like that.
okay, okay.
Like
Mm,
sometimes some woman, uh, even without pushing that hard, she becomes fatigued. So you need to give oxytocin to cause the uterine contraction. Mm,
okay.
okay, okay.
Yeah,
I don't know more than that.
yeah. No, because I feel like I saw a question, but now I don't remember it. But it was saying that you can only give it when I think the cervix is 10%, 10 centimeters
Like
dilated,
after full dilation,
or yeah, or it was like when the baby is already in the like the baby is already coming down. You cannot give it when the baby is still like -1, whatever position. You have to give it when the baby is already like +1 or whatever. I don't know. I don't remember the exact. That's why I was asking because I don't remember the exact wording of that. But anyway, it's okay. I'll check on that later.
okay. A 75-year-old oxytocin, according to ChatGPT, the
Mhm,
ChatGPT 5, oxytocin is typically given during the first and the second stage of labor, but only specific situation.
mhm,
Mm, here is one. First stage, cervical dilation phase for induction of the labor. When labor has not started on its own, need to be initiated, like post-term pregnancy, preeclampsia, PROM, you need to give oxytocin in the first stage of labor. The first stage is not the full dilation.
okay, first stage is the one that's divided between latent and active. So it's from
Yes,
0 to 10 cervix
yes,
dilation.
yes.
And then second stage is when the well,
First stage is onset of true labor pain to the full dilatation of the cervix, isn't
okay,
it?
uh-huh.
So you can give it in the first stage. And another indication for giving oxytocin in the first stage is augmentation of labor when labor has not started, but contraction are too weak or infrequent to progress cervical dilatation.
Mm-hmm.
You got my point? So you can give it in the first stage. You can give it in the second stage. Expulsion of the fetus can be continued if uterine contraction are inadequate, but care is taken to avoid uterine hyperstimulation.
Okay.
Not given before labor starts, like
Okay.
unless there is a medical indication for induction when premature oxytocin can cause fetal distress and uterine rupture.
Mm-hmm.
And you can give it in the third stage, delivery of the placenta. After delivery of the placenta, oxytocin is used after delivery of the baby to prevent PPH. You know this part. So
Mm-hmm.
oxytocin can be given in first stage, second stage, and in third stage also.
Oh, in third stage. Oh, okay.
Third stage for preventing PPH, first stage for initiation of the labor or augmentation. Okay. Question 66. A 75-year-old man is admitted to the hospital of a 3-day history of fever. He has type 2 diabetes mellitus. Hypertension, and COPD. 1 year ago, he had a stroke with residual right lower extremity hemisphere hemiparesis. Medications are amlodipine, tiotropium, metformin, glimepiride, lisinopril, and aspirin. He does not drink alcoholic beverages and has smoked 1 pack of cigarette daily for 50 years. The patient is widowed, lives alone. He has 3 adult children. He is not in acute distress. He is 178 centimeter tall, weight is 82 kg, BMI 26 kg per meter square, temperature 39.2, 102.6, pulse 110 per minute, respirations are 22 per minute, blood pressure 150 by 90, pulse oximetry on room air show oxygen saturation 96%, scattered and expiratory wheezes are heard. There is dense hemiparesis on the right lower extremity. Appropriate therapy is initiated, and 3 days later, the patient's condition has improved. He is awake, alert, and conversing with one of his sons about current event. Temperature is 37.2, pulse 72 per minute, blood pressure 130 by 82 millimeter of mercury. Discharge plans are discussed with the patient, his son, the physician, and the physical therapist. The physical therapist says patient would be cared for a nursing care facility. The patient acknowledges that nursing facility would provide better care for him, but says he would prefer to remain at home while visiting nurse. Once outside the patient's room, his son says, I have the power of attorney. Don't listen to him. He needs to be in the nursing home. Which of the following is the most appropriate?
Ready? Sorry.
Yes.
So it's informed the son that decision is the patient to make, regardless of the medical team recommendation. Um, have to respect autonomy. He voiced his decision. Wait, let me see. I want to know why it's not E. Um, this one.
Your screen is again stuck.
What is happening today?
I don't know actually.
This is crazy. Okay, let me see. I'm trying to find the question. Let me stop it. Or let me call you back. Maybe
Okay.
it's.
A 59-year-old man A 59-year-old man is brought to the emergency department because of 1 hour history of weakness of his left arm and left leg and mild headache. He says that what he was when he was gardening with his wife, he suddenly became unable to hold his gardening tool, lift his left arm, or walk. 2 weeks ago, he had a non-productive cough. Do you know just your screen your screen came just now? I thought you haven't shared your screen
No, I shared it since we started. I don't know what's happening today, but okay.
because every minor detail in your laptop I can see.
Mhm. Who
Okay.
knows? But is it moving though? It's moving.
Um, it is
Let me
stuck in the question 7. You are highlighting something?
No, I'm moving the mouse. Do you see him moving the mouse?
No.
No. Okay.
Okay, just read.
I don't know what's happening.
Okay. 2 weeks ago, he had a non-productive cough and nasal congestion. He had a non-productive cough and nasal congestion that resolved spontaneously after a week. He had hypertension treated with lisinopril on arrival. His lethargy. He is 6 feet tall, weighed 97 kg, BMI 29 kg per meter square. Uh, mm, Pulse, blood pressure 174 by 109. The pupil measure 3 millimeter. Are reactive to light. Muscle movement is decreased over the left lower aspect of the face. Muscle strength is 0 by 5 in the left extremity. Dependent reflex absent in the lower extremity. And 2 plus right on the right extremity. CT scan of the head show large area of increased attenuation of the right putamen region. Which of the following is most likely cause of this patient condition?
Ready?
Yes.
Okay, so it is small vessel disease. Um, what know your concept and make the connections. What stroke is? Subcortical stroke. The upper and lower extremity are affected at the same time, in usually contralateral. Also found in patients with hypertension, which can lead to microaneurysm. Cortical stroke respects cerebral artery strokes. I don't know what that means. It's not amyloid angiopathy, Alzheimer's, and Down syndrome, and can get brain bleeds from that deposition of amyloid in the vessel. So I'm Alzheimer's and Down syndrome. And it's not embolism because that's for AFib and MI and recent MI. So it's small vessel disease. Let me see if I can find
Question 80.
80. Okay. So this patient, the patient's acute onset weakness, mild headache, CT scan of a large area of increased attenuation in the right putamen region, indicate ischemic stroke or ischemic. On the USMLE, small vessel disease is a common cause of lacunar infarct, which often occur in the basal ganglia like putamen and present with pure motor sensory deficit. The patient with acute onset hemiparesis, headache, and basal ganglia lesion on imaging suggest a lacunar infarct. Always consider the location of neurological deficit when narrowing down the stroke etiology. Amyloid angiopathy typically presents with lobar hemorrhage, not ischemic strokes. And then I guess none of the other really makes sense for me. Okay, small vessel vasculitis. So small vessel and like thrombosis kind of thing, I guess.
Small vessel disease, what does they are trying to mean? Is it
I don't
like
know.
like
It's
lenticulostriate artery, the
trying to.
lipohyalinosis?
Okay, so it's high. I think it's lenticular striae because they say it's the putamen. So
Because
what is
small vessel disease, we actually think that small vessel disease is small vessel vasculitis, isn't it?
vasculitis? Yeah. But it's not. I don't think that's what they're talking about.
They are playing with the words, and
Yeah, this is,
and I'm
I
very
think
bad
they,
at this.
I think it's the lenticular striae that you're trying to say. So the lenticular striae thingy is is due to ischemic stroke or like hemorrhagic. What is
It is
that?
ischemic
Is it
stroke,
is ischemic stroke? Okay, so it's
and
like a thrombus.
lipohyalinosis due
Uh-huh.
to atherosclerosis due to ischemia. The
Okay, so it's a like a thrombus.
pathophysiology is like ischemia, not hemorrhage.
Okay. So it's like a thrombus. Okay, so I guess that's what they wanted. Yeah, this word is. I would have never found it with that word, the small vessel disease.
Okay.
Okay. Okay. Next.
A 24-year-old primary-gravid woman at 10 weeks of gestation comes to the office for a scheduled dilatation and the curettage. Ultrasonography 2 days ago showed a fetus consistent in size with a 9 weeks of gestation with absent cardiac activity. 2 weeks ago, the patient had upper respiratory tract infection that resolved spontaneously. 1 year ago, she was diagnosed with herpes simplex virus type 2. Her outbreak was 6 months ago. She has no other history of serious illness. She is 163 centimeter 5 feet 4 inch tall. She weighed 82 kg prior to the pregnancy. BMI was 31 kg per meter square. She has had 3.6 kg weight gain during her pregnancy. Vital signs are within normal limits. The valvular area is shaven. No lesions are noted. Examination shows a normal appearing cervix. The uterus is non-tender and consistent in size. With 8 weeks of gestation, there is homogeneous white-gray vaginal discharge. The pH of the discharge is 5.5. She undergoes dilatation and the curettage with sterile instrument and povidone iodine vaginal cleansing. Which of the following is the strongest predisposing risk factor for postoperative infection in this patient?
Ready?
1 minute, please.
Mm-hmm.
Re- Ready?
Okay. So it is type of vaginal discharge, most likely BV, like I guess bacterial vaginosis. What is the abnormal aspect here? Okay, this doesn't make sense. Ah, type of vaginal. Okay. Okay. The homogeneous white gray vaginal discharge pH more than pH of 5.5 suggests bacterial vaginosis, which increases the risk of postoperative pelvic infections. BV disrupts the normal vaginal flora and increases susceptibility to infections. For USMLE, consider BV a risk factor for postoperative infection following gynecological procedures. Bacterial vaginosis presents with a characteristic fishy odor, homogeneous gray white discharge, and elevated pH, like more than 4.5. Use clinical clues in a gynecologic context, recognize altered vaginal discharge as indicative of an underlying infection that can predispose to further complications. It's not history of upper respiratory infection. It resolves spontaneously and is unrelated to pelvic infections. It's not HSV2. While HSV2 can cause genital ulcer, it's not directly related to postoperative infection unless active lesions are present. Okay. Um, Next, is my screen moving on your side?
No, I'm
Oh,
still seeing the question 108, a
one.
24-year. The answer one. Okay.
And now, because I already put it down.
No.
Never mind. I don't know what's happening today. Give up.
A 74-year-old woman comes to the clinic. 74-year-old woman comes to the clinic. It was very good. I don't know why. I think that we enjoyed a lot with Skype, better than the team. Discord was not that clear,
Yeah,
but
you told me that it wasn't clear on your side.
yes, but it is like it is comfortable.
Mm-hmm.
Discord has paid version. That is the problem. So they
So
made
now, so now we cannot use Discord
no
because it's
no
paid.
you can use Discord, but if you want to see the 4K video in
Mm-hmm.
Discord, you have to pay.
To pay. Oh, okay, I get what you're saying. Okay.
Like lots of people play online games and these and that on
Mm-hmm.
Discord. So there is a you have seen such like study with me this type of video.
No,
You haven't heard about study with me.
no,
Do you know how popular they are?
no. It showed me that with the weirdest thing. You remember you showed
Yes,
me what was
ASMR.
that? Yeah, there's a
They
but
study
Naomi.
with this study with me is far better. What actually they do, the Korean people and the other people, you can see on YouTube that they actually study. They actually like what we are studying. Your hands can be seen, your laptop can be seen. You are studying. Sometimes you are sipping coffee and you are studying for 8 to 10 hours. That is study with me, and it has
Mm-hmm.
million views. Okay, let's study.
So you just share your screen and while you're studying and that's it, and
Yes,
people
yes. You don't believe, just go to the YouTube.
wait, and people just watch you study and that's
Yes,
it.
people look at that.
Crazy. Okay.
World is full of crazy people, and you are in the center of that.
I'm just like I never heard of that. I'm like this is yeah.
You have astonished when you see the million views in the ASMR, isn't it?
Yeah, I mean
Look, just type study with me.
study with me. Let me
Today,
see.
everything is going in a different direction, so let's have some fun.
What? Wait, let me see. Is it this? Oh no.
Yes, 22 million. Look at this one. Just click here.
Okay, and then you just this is crazy.
The background noise. He just made a background noise.
You don't even see what she's studying. You
You
don't
don't
even know
need
what
to know that. He is not sharing his screen. And in the Discord, there are some groups uh, like study with me. Like they actually share their screen. Like
but I mean
you can see some people is having coffee. Some people is like yes, look at her, what she's doing. you
this
just
doesn't even
you can just see her hand. And
yeah, you just see perfect. I thought like maybe I'm studying for step two, you're studying for step, you're sharing your screen. It makes sense if I look at what you're doing, I'm studying for.
no,
But
no,
this you can even see her
they
screen.
don't do it in that way.
Wait, this is stupid.
Look at the video. 8.1, 22 million. So people are watching this.
I'm like, I'm trying to look at the comments. Like, what? How can we please appreciate how quiet she is while what?
The
This
world
is.
is full of crazy people.
I mean, this is. Oh my lord. I mean, I guess she's making money when people once people
She
watch the video
she
that you
is
make
just
money.
make she is making money, and I don't know. Like maybe she's very people are making money with this. This study with me is very popular.
Wow. Maybe I should do that. I mean, we spend our day studying anyway, so might as well just make
You
money.
can do it too.
And I get yeah, and I get to eat and
Yeah, yes, some people eat, some people just your camera in should be kept in such a position that your face cannot be revealed. Like they actually do it in that way. Like look at the
yeah.
they he actually put a candle. He actually like
Yeah, he has like a diffuser and oh my
in your
god.
house there are plenty of things to decorate this kind of, isn't it?
Yeah.
Just you need to decorate your your table in
You
such a way and your
yeah,
camera should be in that position and just study with me.
it's crazy. And they do like 5 hours. You see those ones? Like 5 hours of somebody just watching you. I mean, like we don't know, but I can admit I wouldn't mind doing this.
Just 65K like that means think about how many people watched it.
Hmm. I'm gonna try. I'm gonna see. Maybe when I'll study for my step three, I will start doing this. I wonder how. Yeah, I'll start doing that. Then I'll tell you how much they pay for. How much they pay
If
for
you
that?
can like if you can hit the million then then you then you will be paid.
Oh, it's when you hit 1 million that you
No,
start
no,
getting.
it's not 1 million. There is a thing called you need to have 1000 only 1000 subscriber
Mm-hmm.
and
Mm-hmm.
like 10,000 or 1000 hour watching of your video 1000 hour like there is a calculation of YouTube,
Mm.
then you are paid.
Then you start getting paid. Okay.
Okay,
I'm gonna
okay,
try this.
you can
Too.
keep this idea while like when you are studying you can keep you can do it that there then what will happen, it will enhance your concentration because you know that somebody is watching.
Somebody's watching you. Oh, okay. That's why. Okay, that's
Truly if you think that you are observed you are very careful then
yeah.
your what can I say, your concentration will be increased.
I mean, it makes sense. It does. It does make sense.
And the another thing what you are studying they are not sharing these things so
Yeah,
you
don't
can
share
study by
it.
yourself. Okay,
Yeah.
enough marketing about YouTube.
Enough to study with. You always show me the crazy stuff.
People are doing crazy stuff, so why we should not learn about that?
No, but it's good ways to make money on the side. You never know. It's
Yes,
like to see there
look,
are so many
the
ways to.
person who made this yeah biostat, the hard topics in a very simplified, how
Mm-hmm.
much he what is his viewer, look at his viewer. So people are not ready for the good things. So
Yeah. No, I get it. I mean, I wouldn't mind doing that. It doesn't. You just put the
no,
camera.
in
You.
in your medical like if you do the residency
Mhm.
uh, in you can do some simple clips that can be helpful for the people
Yes.
because what actually doctors do they are very involved in studies so they are actually out of the world
Yes.
and we are actually lagging behind this uh, crazy world. Okay, A 74-year-old woman comes to the clinic 2 days after the sudden onset severe foot pain. She has a difficulty walking during this time and has been using cane. She has not sustained trauma to the foot. Has she has type 2 diabetes, mellitus, hypertension. Medications are metformin, insulin hydrochlorothiazide, lisinopril, atorvastatin. She typically wears support stockings because of lower leg swelling. The foot pain has made it difficult for her to wear them correctly. She is a traveling pastor. Spends his traveling pastor spends more than 4 hours daily in the car. A monogamous relationship. Photograph left toe shows hemoglobin 7.4, creatinine 1.4, uric acid is 7.48. Electrolyte is concentration reference. Which of the following? Is it gout?
Right? That's what I'm thinking. That's the only
But
thing that.
this seems this look like cellulitis. Okay,
Oh
ready
no,
gout.
it doesn't. It's probably gout. No, it doesn't look like cellulite. Oh,
Okay,
why is not the doc?
uric acid is higher too.
No, it's uric acid is normal. It's not high. The high is after 8.2. So it's not. So would it be pseudo gout? Anyway, let's
Pseudo
just check.
gout,
Maybe.
don't think so.
No,
Is it
okay.
infected mucus cyst,
I don't know what is inflated because that's my thing. I don't know.
or
Okay,
is it
let's.
cellulitis?
No, no, it's not cellulitis. That for sure I know it's not cellulitis. It wouldn't look
So
like
it
that.
is gout.
It's gout. Great toe, suddenly hurting, taking thiazide, hyperglut, hypergluc. That was for the thiazide is hyperglu, so hyperglycemia, hyperlipidemia, hyperuricemia, and I don't know what was the C.
Hypercalcemia,
Hypercalcemia.
hyperglycemia, hyperlipidemia, hyperuricemia, and
Okay,
hypercalcemia.
and you treat with NSAIDs, the gout. Okay, and it doesn't say anything about. Let me see if it says something about the other gout. Sudden onset of severe pain in a joint, especially great toe, with hyperuricemia suggests acute Gaudy attack. He doesn't have hyperuricemia anyway. Patients with diabetes and hypertension and on medications like thiazide have high risk of gout. For USME, I always think gout with the abrupt onset of severe joint pain in hyperuricemia. I guess she has hyper. Oh, okay, no, he doesn't have
Sorry,
hyperuricemia. No, no, don't worry about it. I was like, no, the gout level is normal. Gout classically presents with painful, swollen right joints, often the first metatarsal phalangeal joint is called podagra. Recall the connection between diastasis diuretic and increased uric acid level leading to gout. Cellulitis typically involves red, warm, and swelling, but no acute severe pain. It's not infected mucoid cyst, common in the dorsum of the wrist, not typically the great toe. So it's the in the so dorsum of the wrist. So the gout presents similarly, but mostly affects larger joints like the knee. Okay, next. Is my screen moving?
yes.
Okay, good.
A 47-year-old man comes to the office for a routine examination before beginning an exercise program. He feels well. He has a 25-year history of type 1 diabetes mellitus, a grade 1 by 6 early peaking systolic ejection murmur is heard best at the left third intercostal space. Sensation to light touch is mildly decreased over the toes. The remainder of the examination shows no abnormality. The remainder of the examination shows no abnormality. The exercise test shows a 3 centimeter. An exercise stress test shows a 3 centimeter ST depression early in the test. The test does not produce any pain. The test does not produce any pain. Which of the following is the most likely diagnosis?
Ready? Are you there?
Yes, yes,
Oh, ready?
yes.
Oh, okay. It's coronary artery disease, damn it. Any finding in an exercise stress test, coronary vessels aren't doing great. So any finding. ST depression are not normal findings. I did not know that. Okay, let me see. Coronary. The exercise stress test reveals a 3 ST depression, which is suggestive of MI, indicating the presence of coronary artery disease. Patients with long-standing diabetes mellitus, like this individual, increase of atherosclerotic disease, including cardiovascular, I don't know what is it, coronary artery disease, never mind. On the USMLE, connect long-standing diabetes with increased risk of macrovascular complications like coronary artery disease, especially when presented with suggestive findings. In a diabetic patient, even in the absence of chest pain, due to potential diabetic neuropathy causing silent MI, significant ST changes on a stress test only point toward coronary artery disease. Always correlate the risk factors, in this case, diabetes, with the clinical presentation and investigative findings. Okay, got it.
A 22-year-old man comes to the office for a health maintenance examination. He feels well and has not noticed any health issue. He is in the US Army. 2 months ago, he returned from 7. He returned 3 months ago. Can you hear me now?
Yeah,
Okay. Do you want? Okay, just see the WhatsApp.
what's up?
Yes, a
Okay.
22-year-old that comes to.
Oh my lord, that's how my screen looks. Oh, please. I don't know what's happening.
Now
Okay.
it's all right.
Okay, I just
It
unshared
it
it.
it, it came just now.
Okay.
It is very
I don't know
uglier
what's
to look at.
happening. I don't know what's happening today. Maybe the Wi-Fi.
Maybe maybe both of our connection is creating problem.
Yeah, both of our connections look like both of our connections are slow.
If my connection creates problem, then suddenly it does not show anything, but it is showing, but it is lagging.
Mm-hmm. Hmm.
Okay, a 22-year-old man comes to the office for a health maintenance examination. He feels well. He has not noticed any health issues. He is in the US Army. 2 months ago, he returned from 10th month deployment to the US, which he started smoking 1 pack of cigarettes daily. The patient says he is happy. The patient says He is happy to be home and has been celebrating with his friends and family. He has been consuming average 6 beers daily, and since returning to the United States, he has not history of major medical illness. He does not want to use any medication or other substance. His mother had type 2 diabetes mellitus. The patient is 180 centimeter tall. The patient is 180 centimeter tall. Weight is 72 kg. BMI 22 kg. His fast blood pressure reading is 156 by 95. Repeat reading is 160 by 92. He says that he remembers his blood pressure being normal when he had it checked in the past. Physical examination discloses no other abnormality. Which of the following is the most likely cause of this patient's increased blood pressure?
Ready?
1 minute, please.
Okay.
Ready.
Okay. So it is excessive alcohol use. Since he came back, he's been drinking more. Not cigarette smoking, was also smoking when he was out of the country. Essential hypertension more in regards to obese patient. Rapid increase in BP in a fairly healthy young patient who just started slamming beers daily. I don't know what that means. Okay. Ay, let me see. Excessive alcohol. Let me something. Excessive. Okay. The patient consumption of an average 6 beers a day is indicated of excessive alcohol use, which is a well-known reversible cause of hypertension. The elevation in BP may return to baseline upon reducing alcohol use. For USME, understand that chronic excessive alcohol consumption defined as more than 2 drinks per day. Oh, that's what I was asking. That's what I was telling you. More than 2 drinks per day for men and more than 1 drink per day for women. I need to remember that. Because elevated BP. Recognize lifestyle factors that can contribute to hypertension. Excessive alcohol is a major modifiable risk factor. Always consider secondary cause of hypertension in young adults, especially when they present without other risk factors for primary hypertension. Cigarette smoking not typically associated with hypertension. Essential hypertension, one common primary of essential hypertension is usually diagnosis of exclusion. Okay, it's alcohol. More than 2 drinks for men and more than 1 drink for women. Next.
A 32-year-old man comes to the office because of 3-month history of painless rash over her arms. During the past month, he has had 3.2 kg weight loss despite no change in the appetite. Despite no change in the appetite. He has no history of serious illness, takes no medication. 5 feet 9 inch, 7 weight 72, BMI 23 kg per meter square, pulse 98 per minute, vital signs are within normal limits. Lungs are clear to oscillation, cardiac examination shows no abnormality. A photograph of the left upper extremity is shown. Similar findings are noted over the right upper extremity, which of the following is the most likely cause of this patient's dermatologic pain.
Ready?
Oh, yes.
Okay. With Kaposi, we have an image. The image is necessary but utilize the clues. Painless rash and loss weight can be diffuse. It's not dermatitis. It's not lichen planus. It's polyclonal. I think they want to say polyclonal. Purple plaque. Let me see if this is something different. Yeah. Kaposi sarcoma presents a painless violaceous macular rash associated with HHV8. Kaposi can manifest as in immunocompetent and immunocompromised patient, but the latter is more common in setting of HIV. For USMLE, a rash accompanied by systemic symptoms such as weight loss hints towards underlying neoplasm and systemic disease, in which Kaposi sarcoma is a classic dermatologic malignancy. When presented with violaceous rash and systemic symptoms in a relative young adult, always consider Kaposi. Recognize the classical appearance of Kaposi lesions to identify the diagnosis quickly. Now, dermatitis herpetiformis is intensely pruritic rash associated with celiac disease, cluster of itchy blister papules. It's not like implant, manifest as pruritic polygonal purple papules and plaques with the white reticular pattern. Welcome, try. Purple polygonal pruritic plaques and papules. Okay, next.
Yes. A 42-year-old newly-gravid woman comes to the office because of 6 month his because of 6 month history of hot flashes and intermittent palpitation. Her last menstrual period was 6 months ago. Mens previously occurred at a regular 29 days interval, but gradually has occurred less frequently during the past 2 years. He underwent over cystectomy 13 years ago for a small benign teratoma. She used an OCP for 12 years until a tubal ligation 6 years ago. Her and mother and sister had menopause at the ages of 47 and 49 years respectively. The patient had smoked one pack of cigarettes daily for 26 years. She is sexually active and monogamous with one male partner. She is 170 centimeters, 5 feet 7 inches tall, weight 86 kg, BMI 30 kg per meter, pulsated to permanent, blood pressure 130 by 85. Physical examination including pelvic examination discloses no abnormalities. Which of the following is the most appropriate next step? See in the menu. Ready?
Yeah. So it is measurement of FSH, hormone concentration. Someone in 40 having some type of menopausal symptoms, check FSH, which will be elevated. Let me check something. Measurement of, let me see, measurement of serum follicle. Follicle. Okay, right here. This patient presentation with hot flashes, palpitation, and amenorrhea suggests onset of menopause. Elevated FSH is due to decrease in inhibin production and decreased estradiol feedback from the ovaries. For USME, understand that menopause is diagnosed clinical, but if confirmation is required, elevated FSH is the most indicative. Menopause typically occurs between 45 and 55, can present with vasomotor symptoms like hot flashes and irregular menstruation. Link decreased ovarian reserve with decreased FSH due to reduced inhibin and estradiol feedback. Measurement of LH. LH also increases during menopause, but FSH is more commonly used for confirmation. Doesn't make sense. Pelvic ultrasound not indicated without specific gynecologic symptom. The menopause diagnosis is clinical. Okay, next.
Yes. A colleague of 47-year-old physician who is conducting patient evaluations during afternoon walk-in clinic hours notices that the physician appears groggy and has slurred speech and smells of alcohol. Groggy. Earlier in the day, the physician has attended a celebratory lunch for graduation of the one's clinic employment for nursing school. The colleague has not witnessed similar findings in the physician in the past. The physician is scheduled to work at the clinic for the next The physician is scheduled to work at the clinic for the next 4 hours. A physician assistant is present at the clinic and typically aids for the patient with evaluating patients. Which of the following is the most appropriate action for the colleague to take at this time? Ready?
Yes. It is report the physician to the clinic administrator and conduct a reminder of the clinic hours without him. Impaired physician remove from clinic and reported to the higher up. It's not. It doesn't say why it's not the other ones. Let me see. Report. Okay. Patient safety is paramount. A physician under the influence poses a significant risk. Reporting the physician to the clinic administrator ensures accountability while continuing the clinic hours. Without him, ensures patient care continuity. For ASM, they always prioritize the immediate safety of the patients over potential repercussions to the involved physician. When faced with ethical dilemmas on the USME, also choosing the option that prioritizes patient safety and well-being is a good rule of thumb. In cases of impaired physician, immediate action is necessary to prevent potential harm to the patient. Merely confronting the physician and asking the physician to leave may not guarantee that the physician complies and does not address reporting. Cancel clinic hours to resource patient care without addressing the root issue. Okay.
Next. A 68-year-old woman returns to the office for a follow-up examination 1 month ago. Urine analysis showed protein during workup of a suspected UTI. At that time, the patient was prescribed a 3-day course of oral cephalexin. Today, she says her previous pain on urination and urinary frequency has resolved. She has major depressive disorder and osteoarthritis. Current medications are venlafaxine and acetaminophen. Temperature is 37 degrees Celsius, pulse 66 per minute, respirations are 18 per minute, blood pressure 122 by 76 122 by 66 millimeter marker. The patient appears physically fit. Examination discloses no abnormality. Repeat analysis is shown. Specific gravity 1.015, pH 6, uh, protein negative, blood negative, leukocyte negative, negative, WBC3 high power field, WBC3 high power field, RBC1 high power field. Which of the following is the most appropriate additional diagnostic study? Which of the following is the most appropriate diagnostic study at that time?
Oops.
Okay, ready?
Yeah. So it is no additional testing. Person had a UTI. The UTI resolved. Person is okay. Do nothing. I think it makes sense. Do you want me to find the other
No,
one?
no. A 22-year-old man is brought to the 22-year-old man is brought to the emergency department because of severe right lower pain. Since he fell into the woods during a camping trip 2 days ago, the pain has worsened during the past 12 hours. He sustained a small scratch below the knee as a result of fall. He has no history of serious illness. He has no history of serious illness, uses no medication or other substance. He does not drink alcohol, pulse 110 per minute, respirations 14 per minute, blood pressure 105 by 60 millimeter mercury. Examination of the right lower extremity shows edema, diffuse cellulitis and hemorrhagicula from the knee to the ankle. No abnormalities of the left lower extremity are noted. Peripheral IV antibody therapy and insulin crystalline fluid are begun. Which of the following is the most appropriate next step in the management? Ready?
Yes. So it is surgical debridement, hemorrhagic bulla, necrotizing fasciitis, star, IV antibiotics, then debride. Let me see if I surgical ah surgical debridement. The clinical presentation suggests necrotizing fasciitis, rapidly progressive soft tissue infection characterized by vascular subcutaneous tissue and fascial necrosis. Early surgical debridement is essential in necrotizing fasciitis to remove dead tissue and stop disease progression. For USMLE, remember that clinical findings suggested for necrotizing fasciitis, pain out of proportion to physical finding, bulla, rapid progression, warrants emergent surgery. Necrotizing fasciitis presents has severe pain, edema, erythema, wart, and often systemic symptoms such as fever, hypotension. Always associate rapid advancing skin changes with potential underlying necrotizing infection. It's not a, I guess MRI may delay surgical management in a clear clinical picture of necrotizing fasciitis. And hyperbaric oxygen therapy, immediate surgical intervention is priority. Okay, next.
Yes. A 27-year-old man 27-year-old woman, gravida 3, para 12 weeks of gestation, comes to the office for her first prenatal visit. Her first child was delivered at 41 weeks of gestation and weight is 4.1 kg. Her second child was delivered 37 weeks of gestation. The weight is 4.3 kg. She has no history of serious illness. Her only medication is prenatal vitamin. Her sister has a history of delivery. Her sister has a history of delivery stillborn. Her mother and father has type 2 diabetes mellitus 8 months ago. The patient immigrated to the US from Mexico. The patient is 157 centimeter tall. She weighed 95 kg prior to her pregnancy. BMI was 38 kg per meter square. She has had a 3 kg weight gain during the she has had 3 kg weight gain during her pregnancy. Pulse is 80 per minute, respiration 14 per minute. Blood pressure 110 by 60 millimeter of mercury. Bimanual examination shows uterus consistent in a size with a 12 week gestation. Ultrasonography confirms 12 week gestation. Which of the following is the most appropriate next step in the management?
It's a tricky question. Do we do fasting on pregnant women? Fasting glucose?
We do OGTT.
But that's oral glucose. Is it fasting one?
I don't think
I
so.
don't think it's fasting. So if it's not fasting, okay, she's coming from Mexico. So we do checks X-ray for TB. Can we do X-ray on a woman, or is it the radiation?
Usually we skip it. If it is necessary, then
Okay, or then it will be antiphospholipid because the sister it was the sister that had the, not her.
she has no lots of pregnant history. But second child was
The child was, both of the baby were huge,
yes,
really big. We definitely, I mean, she definitely has an issue with glucose, but I don't know if we do fasting glucose for pregnant women.
fasting
I think
glucose tolerance test.
I thought it was oral.
Yes,
Okay, let's check. Ready?
let's see. Okay,
Okay. So it is, I guess, yeah, fasting glucose tolerance test. Patient is fairly obese and had two babies earlier with macrosomia. He didn't say anything else. Let me check. Fasting glucose. Okay. Given the patient history of delivering large babies, her obesity, and family history of type 2 diabetes, she's at increased risk of gestational diabetes. USMLE is vital to recognize that women with risk factors for gestational diabetes should be screened at the first prenatal visit. Gestational diabetes screening typically involves an initial glucose challenge, followed, if abnormal, by more definitive glucose tolerance tests. Okay, so glucose challenge. So I guess that's the fasting, but then glucose tolerance. That's crazy. Key triggers for early gestational diabetes are prior gestational diabetes, obesity, large babies, and strong family history of diabetes. Be wary of typical screening time 24, 28 for gestational diabetes. High risk patient like this one should be screened earlier. It's not chest X-ray, there's no indication of representation. It's not antiphospholipid, indicated by recurrent unexplained miscarriages, not stillbirth alone. Recurrent and unexplained miscarriage. Okay. Okay, so I guess we do fasting. Boost tolerance there. I didn't know
Next,
that. Okay.
an 84-year-old woman comes to the office because of 1 month history of malaise. She has not had fever, weight loss, or abdominal pain. She has type 2 diabetes mellitus well controlled with long-acting insulin and metformin. She has missed multiple appointments during the past 6 months. She is also during the past 6 months with no reasons given. His hemoglobin A1C, the daughter, her hemoglobin A1C 6 months ago was 6.7. She says that she has been feeling fine. Her mother had moved back in her home 9 months ago because he had lost his job. The father's husband died 5 years ago. She has no history. She has no other children. He appears unkempt. She is alert and fully oriented. She is 163 centimeter, 5 feet 4 inch tall, weight 77 kg, BMI 29 kg per meter square. Her pulse is 80 per minute, regular respiration 80 per minute, blood pressure 160 by 94 millimeter of mercury. Mucous membrane are dry. There is no thrush. The skin is dry and intact. The remainder of the physical examination show no abnormality. Mental status show no memory deficit. She has a normal mood and flat effect. The fasting blood glucose, her fasting blood glucose sensation 380. The results of the urine analysis glucose 4 plus non-ketone glucose and no. Which of the following?
Ready?
1 minute. Ready.
So it's elderly neglect. Patients that are not well cared for, miss multiple appointments, elder abuse call services. Let's see. Elder neglect. The patient has deteriorating self-care, missed appointments, unkept appearance, elevated glucose, started after her son moving. For USMD, it is essential to recognize that elder neglect can manifest a worsening medical condition despite no overt sign of physical abuse. Elder neglect can manifest as failure to meet self-care needs, lack of medical follow-up, and sudden decline in chronic medical conditions. Consider socio-environmental causes for a sudden change in a stable patient condition. Dietary indiscretion, this will not explain the unkept appearance and missed appointments. And MDD, though she has flat affairs, there are no over sadness, anhedonia, or other major depressive disorders. Okay.
Next.
Mhm.
A 15-year-old boy is brought to the office brought to the office 2 hours after he awake with weakness of the right side of the face. He has a 2 week history of intermittent. He has a 2 week history of intermittent sensory output. Flexion of the neck elicits moderate pain and a resistance. The right eyelids do not close completely. Ocular pains are normal. There is no evidence of ptosis. The right side of the forehead doesn't wrinkle when he looks upward. There is severe weakness on the right corner of the mouth. There are no abnormalities on the left side of the mouth. Muscle strength of the jaw, tongue, coordination of the intact. Gait is normally lumbar puncture perform. Opening pressure is 180 centimeter. Uh, CSF is glucose 60, total protein 52, WBC 85. Segmented neutrophil lymphocyte 70% of all the RBC 1% of all is the most appropriate step.
Ready? I'm off.
Ready?
Oh, okay. It's measurement of Lyme antibody concentration. Lyme IV ceftriaxone. Let me see. Measurement of Lyme. The patient presentation of facial nerve palsy, Bell's palsy combined with history of headache, photophobia, and meningismus in endemic region like New Jersey, Lyme disease. Wait, Lyme causes meningitis too?
Yes.
Oh,
Neonatal meningitis has three causes. Sorry, Lyme, Listeria, Lyme disease, tick bite. Dude, Lyme causes.
does it?
Don't
No,
remember.
Lorelia, Lordofery. Does it cause meningitis? Patients target rash, fatigue, chills, muscle pain, infanular.
Yes.
It says Bell palsy. What is the meningitis? Oh, oh, never mind. Yeah, it does. Stage 3, meningitis and encephalopathy. They swing a mannequin arrows through the head on the stage 3. Okay. Okay, I guess that's the meningitis and the encephalopathy. I did not remember that. Okay. Uh, the Lyme disease can present with neurologic manifestations such as partial nerve palsy and lymphocytic meningitis. For USME, linking the clinical diagnosis, the clinical findings of accepting meningitis and facial palsy is in an endemic region to Lyme disease is crucial. Think of Lyme disease with the triad of facial nerve palsy, meningitis symptoms, and history of possible thick exposure in endemic region. The importance of geography, I always consider Lyme disease in patients from endemic areas presenting with neurologic and MSK symptoms. Um, it's not what else was I confused about. I guess antinuclear antibody value for autoimmune disease or not autoimmune conditions, not like here. Okay, next.
Yes. A 2-year-old girl is brought to the emergency department because of loud breathing, harsh cough, loud breathing, harsh cough, and hoarse cries awake since awake 1 year ago. Her uh, parents state that yesterday she had run in with medical history is unremarkable. She receives no medication. Treatment is 38.5. Temperature is 100 to 103. Pulse 120. Primary resolution 32. blood pressure 100 per minute, suppressed means of inspiratory strategies are ready.
Okay, so it's nebulized epinephrine, loud cough, harsh stridor, upper airway, croup, laryngotracheobronchitis, vestibular signs, stable, supportive care, even stable. Then, I guess nebulized epinephrine and IV steroid, epinephrine to airway, and then steroids after. Okay, epinephrine to airway and steroid after.
Ready.
after.
Can we stop here? My
Yeah,
brain is
yeah,
not working.
me too. It's too much today.
Okay, we'll finish tomorrow, and tomorrow, like our